The second topic in our education series looks at the role of scanning when investigating pain, specifically X-ray, MRI and ultrasound. Often people who experience back pain feel a scan is necessary to determine what is causing their symptoms. And while it's perfectly understandable to want further investigation, there is a poor correlation between scan findings and symptoms, as it is possible for you to feel severe pain with relatively normal scan findings, or conversely, you may have a scan which shows lots of age-related changes with no pain. Scans such as MRI and X-rays have an important role and are useful in detecting more serious underlying causes, such as cancer, an inflammatory condition, infection, or a fracture. A scan is also useful for surgeons to assess if a person may require surgical intervention. However, these types of back pain conditions are present in a tiny percentage of people. The vast majority of people with low back pain present with symptoms highly likely caused by relatively non-serious injuries to ligament, joint and muscle in the lower back. Most patients refer to physiotherapy for assessment and treatment of back pain from either their GPs or A&E will have been screened for serious causes. Therefore, scans are not typically indicated because we know that a picture of your spine won't make it feel better, but moving will. From a physiotherapy perspective, we know the vast majority of people will naturally want a quick fix solution to make the pain go away. But when it comes to back pain, there is no instant solution, and scans don't make you feel better. In fact, scans routinely show findings that are not always relevant to the person's clinical presentation, and sometimes the results might make some people fearful about moving or participating in physical activity, which can negatively influence how people cope with their symptoms. This slide highlights the relationship between what we would consider normal scan findings and age. In the table shown, there are some fascinating findings from a study that reviewed the MRI scans of over 3,000 participants who do not suffer back pain. The study found high percentages of disc degeneration, disc height loss, disc bulges, and other spinal changes in these participants without back pain. These findings show it is perfectly normal for these changes to be present in the spine as we get older. There is also evidence of degenerative changes being present in people as young as 20 years who experience no pain. The study clearly illustrates that scan findings can be considered normal, especially in the context of a normal aging process, and can give a snapshot of our spines at different time points in our lives. It doesn't necessarily mean that we will have pain with these age-related changes. As we age, we can see external signs on the outside of our bodies, such as graying hair or wrinkles. However, we can't see what is happening on the inside of our body, and this is aging too. In physiotherapy, we like to think of age-related changes as wrinkles on the inside, and we are all aware that wrinkles don't hurt. So we have explored how age-related changes are normal. We've explored how scans are useful in the detection of more serious conditions, and how scans might be useful for surgeons if you need an operation. But the harmful side of a scan is that we can be led to believe that the changes are the cause of our pain. This can create a sense or feeling that we need protection and fixing, and therefore scans and their interpretation can exacerbate the problem by making us feel fearful and anxious. This in itself can influence our behavior and potentially make the problem worse. Key points to remember are that you are not your MRI or X-ray. Changes seen on X-ray that were once thought as problematic are normal changes associated with age. Many of these changes can even be helpful. Abnormal findings are often considered normal in the context of age.